All right, so moving on to fibrous inflammation and fibrosis. We're talking about laying down of collagen, proliferation of fibroblasts. So this is going to start during chronic inflammation, but it's also going to go after inflammation and into the resolution and healing and repair, where it's going to become the dominant cell type is the fibroblasts and collagen. Fibrosis is pretty nonspecific, so it's involved in the repair phase of most forms of chronic inflammation. So diffuse granulomatous, tuberculoid granulomatous, lymphoplasmacytic, any chronic inflammation is going to usually involve at least a little bit of fibrosis. And then importantly, we're going to talk about the regenerative capacity of different tissues and cell types. And fibrosis is really the only way to achieve repair in places where your body has limited regenerative capacity. So like in your heart, if your heart becomes damaged, you're not going to be able to repair that by making new heart cells. You're going to have to fill the defect with a scar tissue with fibrosis. Okay. Super important. Seems really simple now, but this will haunt you for your vet school career. Fibrin and fibrinous are totally separate from fibrous and fibrosis. Fibrin is an acute blood protein that clots your blood. Fibrosis is scar tissue. It's chronic. It's made by fibroblasts. No relationship. You know, they sound disgustingly similar. I'm sorry, I did not write these terms. Okay, another one. Granulation tissue, granuloma. Not related, not the same, no connection. Do not associate them in your head. Granulation tissue is baby scar tissue. So when we first start laying down collagen, what happens is we need fibroblasts to proliferate. Fibroblasts undergoing hyperplasia. They're producing collagen, they're secreting collagen into the matrix, but it's immature. Collagen has to go through a maturation process where it becomes cross-linked and stabilized and really firm and tough, like mature scar tissue. All of this baby scar tissue formation is induced by growth factors and cytokines from macrophages primarily. So we've talked mostly about macrophages as being participants in the chronic inflammatory response, but they are also critical participants in healing fibrosis. Okay. In addition to fibroblasts proliferating, you're also getting angioblasts, making new capillaries. So you have to be able to feed all these cells that are proliferating here. So new capillaries come in. These factors are induced by hypoxia in the lesion and also growth factors from macrophages. So again, macrophages are really key in this process. Basically, the goal or the point of granulation tissue is to fill in a defect while the inflammation and all the debris is being cleaned up and removed. So again, it's baby scar tissue. It's performing the same role. It's just starting to fill in that space. In areas where you're able to repair, where cells are able to regenerate, this granulation tissue is also going to serve as like a scaffold for stem cells to migrate in and repopulate that tissue with epithelium, with parenchymal cells, with whatever it is. So what this looks like, because it's immature scar tissue, the collagen is not super structurally sound, and these baby capillaries are leaky and not very competent. Granulation tissue often looks kind of wet and oozy. They named it this because it has a kind of granular appearance. Not because it's related to a granuloma, but if you look especially on this one, it looks juicy and granular, right? That's why they named it granulation tissue. So this is a big area of ulceration on the skin. We've lost epithelium down below the basement membrane. We've exposed raw bleeding dermis, and granulation tissue has covered all the exposed area. So that's the first step in healing. The next step is for these epithelial cells at the periphery to migrate over that granulation tissue and make new skin, right? Okay. It also has a pretty classic histoappearance. Don't really worry about it, but it's kind of cool because we get collagen arranging parallel to the wound and new capillaries are arranging perpendicular to the wound, so it makes this really cool like crosshatch appearance when we look at it under the microscope. There's all little baby leaky capillaries, they're a mess, look at all this fluid out here, leaking neutrophils, lots of lymphocytes. Here's what that looks like grossly. So think of any wound you've seen where skin was not able to immediately cover the wound and seal and form a scab, right? You're gonna get proliferation of this pink, kind of wet, oozy, granular looking stuff. There's some more. This is a wound in a dog. What is this stuff on the surface? It's on the surface of an ulcer. It's fibrin. Under here, the red stuff is fibrosis. Fibrin, fibrosis, the same picture, totally different. Together, it's separate.
Fibrin in this case, it's not the fibrin, the coagulation factor.
It's the same fibrin.
It is.
There is only one fibrin. It's the same stuff.
Great.
So, because these are oozy new vessels, they are leaking plasma, which contains fibrin. So you might see fibrin on the surface of granulation tissue in the oozy phase. All these little brown crusties are probably little fibrin chunks. Anybody know what this condition is in a horse? When we have excessive granulation tissue? Proud flesh, that's proud flesh. It's excessive baby scar tissue. The body was trying to make a scar, didn't get the message to stop, and it's just making too much scar tissue. Here it is on an eye. Sometimes we call this pannus. This granulation tissue covering probably a corneal ulcer. There's pretty severe diffuse clouding of the cornea. That's corneal edema. You have this pink fleshy mass adhered to the surface of the cornea. There's also, you see these little blood vessels coming in. So normally your cornea should be avascular. So there's new vessels coming in to feed this mess. Okay, know this, love it, remember it. They are not same, they're not related. They might be present at the same time. You might have granulation tissue in granulomatous inflammation.
So I know the macrophages are stimulating granulation tissue, but like what kind of original soul?
Anything destructive.
Okay.
Yeah.
Long term, is it something?
Anything, yep, anything chronic and tissue destructive, where there's been inflammation, where there's been repair. It is totally non-specific. Other questions? Yeah.
Granulation tissues. I've always sort of thought that the epithelium starts growing from underneath.
We're gonna talk about that. Yeah, please hold. Maybe tomorrow, Friday. All right, fibrosis. So granulation tissue, baby scar tissue, over time matures into mature scar tissue, which we then call fibrosis. The maturation process, again, collagen is being synthesized by fibroblasts, it's being excreted to the extracellular matrix. You then cross-link your collagen strands for strength. This requires vitamin C. Very important. You know the disease that's caused by lack of vitamin C? Scurvy. We have a question about that. So if you don't have vitamin C, you can't cross-link your collagen, you have fragile collagen. Over time, again, fibrosis is just a scar. So think of any time you've cut yourself and watched what the wound did over time, right? It starts kind of oozy and proliferative, and then over time it actually contracts, right? And it causes deformation of the skin around it, a little bit of like puckering. So what's happening is there are myofibroblasts. You know what myo means? Muscle. So these are contractile fibroblasts that will actually contract and pull the wound closed and pull it together. That's really critical in things like this patient, right? We want that wound to contract to become as small as possible because this is a lot of things. This is a dehydration risk. They're losing fluid from this. This is a big infectious risk, right? They're susceptible to secondary infections in here. So we want help closing that wound. So that's your myofibroblast. And this is the hand signal. If you need to call in a myofibroblast. Come on. What happens when we're contracting the wound? That's gonna cause pressure, atrophy, degeneration on all these little baby capillaries that we made, so they're gonna degenerate. Because we don't need blood in a scar. Once the healing is done, once we've brought in all the growth factors and the macrophages and cleaned everything up, we want an avascular tough scar that's just collagen, pretty much. So the squeezing together of the collagen by the microfibroblasts is gonna cause pressure on the capillaries, that's gonna cause them to degenerate and disappear. The significance of this is an irreversible change. So once fibrosis has been laid down, you can do a little bit of remodeling, but a scar is a scar is a scar, and it's gonna be there for the duration of your stay with us here on Earth. There's also potentially a loss of function. So whenever you've laid down a lot of fibrosis, it means you've lost something there, right? So we're gonna talk a lot about healing. Fibrosis is the way we replace areas of loss where we cannot regenerate the cells, right? So often fibrosis indicates that we've lost something there that it's replacing. Importantly, fibrosis is never, ever, ever, ever as good as the stuff it's replacing, no matter where it is. So even like in bone, even in a tendon, fibrosis is never better than the OG tissue, okay? Remember, because of the contraction of the myofibroblast, this can also cause significant distortion of the tissue. And if you're in a place that can't tolerate a lot of distortion, like if you're, say, a loop of gut and the contraction goes this way, that's a stricture. You're gonna get narrowing of the lumen, you might get an obstruction. So a stricture is when you have fibrosis, usually in a ring, and as it contracts, it closes off the lumen of the thing. That's a stricture, and that can be potentially life-threatening, depending on where it is. It can happen in the airway, and dyspneic, it can happen in the guts. Any tube really undergoes stricture. You can also get adhesions. So adhesions are placed where scar tissue has connected to things like the liver and the body wall, like the urinary tract from that pig lab last week where the bladder was fused to the body wall. That's fibrosis. You could not manually pull that apart. It was stuck for life, there forever. So depending on where you are, those adhesions can also be life-threatening. Again, going back to the gut, if you get adhesions between loops of bowel, your guts are always moving around and sliding over each other in there. If they get stuck, you're prone to things like torsions, right? Loops spinning on itself, potential obstruction, right? There's a condition called sclerosing encapsulating peritonitis. It's also called abdominal cocoon, where all of your organs are encased in fibrous tissue. It's non-expansile, it can't expand, so you're gonna have trouble, like, moving things, right? You're gonna have, reduced gut lumen because they can't stretch and expand, stuff like that. So fibrosis can have really severe consequences depending on where it's laid down in the body. Here's what it looks like. Everybody knows what a scar looks like. Just imagine that inside your organs. You're halfway there. It's white, it's avascular, there's no blood vessels. If it's on skin, you're gonna lose hair in that area, so you're gonna lose adnexa. So there's gonna be an area of alopecia. Scar tissue fibrosis is very firm. It's inelastic. It doesn't have a lot of capacity for stretch. And it's gonna contract and distort the tissue. So whenever you see like pitting or contraction or this pitted wrinkled surface of the kidney here, that's probably gonna be fibrosis. Confirmatory evidence. Is there something going on around the tissue that's causing atrophy or loss of parenchyma? Why are we putting scar tissue here, right? It's responding to something. So what else is going on here? Do we have a reason to lay down scar tissue? Do we have chronic inflammation? Chronic inflammation and scar tissue go hand in hand, right? Because their chronic inflammation is very destructive. So look for that confirmatory evidence. Okay, let's pause there. 2 minutes for questions. Hey, yeah.
Granulomatous.
Yes.
So it always start as a tuberculoid or use granuloma.
No, it's a different thing.
It's
It's a different thing.
Okay.
Yeah. There's still TH1, TH2 in there though, because it always is.
Okay.
Right? So they will be more nodular looking with the creamy center if it's more Th1. And it'll be more a mix of macrophages and neutrophils without organization if it's more Th2. Make sense?
Is scar tissue innervated? Is coming from experience, I feel like scars sometimes feel like more hypersensitive to pain. I'm not sure if that's.
No nerves in the scar. You might, so if you get, I almost cut the tip of my finger off, cutting an apple on a dead body. And I have like a weird nerve thing there because I think I transected a nerve and the end never really sprouted back. Nerve regrowth is a weird thing and can cause some pain if you have like persistent pain that can be, it's actually like hyperplasia of nerve endings. You can get, it's called a neuroma, and it can be really painful, so you can have like weird nerve regrowth at sites of injury, but scar tissue has nothing in it but just no blood, no nerves, no feeling. So get your scar checked out if it hurts. Anyway. Other questions?
Also about scar tissue, like sometimes when we have one, like we can see like it's healed or like disappeared from like the epidermal surface, but like histologically, you would always be able to tell the damage.
It depends whether it's first or second intention. And we haven't talked about that yet. First intention is I cut it with a scalpel blade and the ends came perfectly back together. I wouldn't be able to tell there was a scar there. Second intention is anything else, any gap. So if it heals with granulation tissue and re-epithelialized, I'll be able to see that. We often get revision surgeries, so they'll send me a tumor and I'll say, it's this kind of tumor, but the margins are dirty, you didn't get all the tumor out, and then they'll go in and do a second surgery. I can often see the scar and the scar tissue from their first surgery. I can often see suture still from their first surgery with little granulomas around it, very cute.
So it's like a perfect little slice, like from a scalpel, some scalpel, better blade, then, do you get a drainage? Good size of.
Minimal, yeah. All right, see you.